Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Well, that's right. We welcome back. This is the Drive with the Area Gang. It is time we talk health. We take a look at our health this afternoon. We're talking tuberculosis. Today, we don't have Dr. Mefajide with us on the show, but we have a very wonderful nurse joining us. She's got a beautiful name as well. You need to take your time to mention her name. Yeah, the name has just been mentioned to me. So let me take my time, mention it, and welcome you to the show. It is Armah Ehoneah Ndah. I got it right. Yeah. But you know, there's something fascinating about your name. It has plenty H in it. All the H2, they are useless H's because if you take out all the H's, apart from the one after the E, it will still sound the same.
You just made me laugh.
Yeah, I'm looking at the name like Armah. There's an H at the end. If you take it out, it will still sound Armah. Ehoneah, there's H at the end. If you take it out, it will still sound the same. And then that will sound the same. I don't know. Anyways, that's a beautiful name. Yeah. It's in Zuma, right?
Yes, please.
Yeah. You are a DOT nurse at Weija-Gbawe Municipal Hospital. What's a DOT nurse?
.nurse.
Nurse.
Yes.
Okay.
So, you see, when it comes to, we are going to talk about tuberculosis today.
Yeah.
So, when we get to the treatment side, you get to know that sometimes we have to observe you directly as you take your medication.
Okay.
So, DOT, direct observation therapy.
Oh,
so,
okay.
you need a nurse who's going to do that for you.
You know, you've made tuberculosis sound like a good thing you should have. So you have a dot nurse with you. But I know, it's sickness. You don't want to be sick. But sometimes you want to be sick to come to the hospital and experience some wonderful nurses. But let's talk about tuberculosis. What is tuberculosis?
Okay, so tuberculosis is just an infectious disease that usually affects the lungs. It can affect other parts of the body, but it mainly affects the lungs.
Okay. Tuberculosis. It's infectious.
Yes.
Meaning you could get it from someone who is infected?
Yes.
That's the
please.
case. Okay, let's look at the different types of tuberculosis, and then also, most importantly, what causes it?
Okay, so like I said, it mainly affects the lungs. So the type that affects the lungs, we call it pulmonary tuberculosis.
Okay.
And then the parts that affect other parts of the body, we call it extrapulmonary tuberculosis. So it can affect your knees, it can affect your brain, any other part of your body. If it is not the lungs, we are calling it extrapulmonary tuberculosis.
Okay.
But if it affects your lungs, we call it pulmonary tuberculosis.
Okay.
Yeah.
And what causes it?
Okay, it's caused by a bacteria known as Mycobacterium tuberculosis.
Okay.
So what happens is that, first of all, before you can get TB, an infected person with TB will have to cough or sneeze into the air.
Okay.
And then you, the person who has not been infected, will have to inhale the Mycobacterium tuberculosis into your lungs. And the incubation period, depending on your immune system, it takes usually between 2 weeks to 10 weeks.
Okay.
And then you also start exhibiting signs and symptoms of tuberculosis.
Is it widespread? Is it common in Ghana?
Oh yeah, tuberculosis is common in Ghana, but not too common because if I take
Because I just got scared, like, the way you said somebody will have to cough and then I'll inhale. I'm like, okay, I'm walking around, somebody has tuberculosis, is coughing there, and lately you see a lot of people coughing,
Yeah, but you see, right now in Ghana, when we are kids, we are fortunate. They vaccinate us with the BCG.
Okay.
So it's still common in Ghana, but let me say, if I take 100,000 people, only 136 would
136.
Yes, will have TB. Okay. So even if it's common, it's not too common.
Yeah.
Yes.
Yeah. Okay. All right. But who is at risk of contracting tuberculosis?
Okay, so health workers like myself, health workers who take care of TB clients are at risk of getting TB. And then those who smoke, those who take in alcohol. If you have had TB before, you are at risk of getting tuberculosis.
Again?
Yes.
Whoa.
If you have had it before, you are at risk of getting it again. So you have to be extra careful if you have had TB before. And then lastly, those who have HIV, because they have reduced immunity because of the HIV virus, they are also at risk of getting TB. But apart from these people, it's very scarce that somebody will get
tuberculosis.
Yes, please.
Okay. But you talked about immunization. So if you are immunized as a child, is there still that possibility that you get tuberculosis sometime in life?
Oh, yeah. You can get it once in your lifetime. You can get it. You can even get it more than once.
Okay.
The thing is, once you are immunized against the tuberculosis, it doesn't mean you can't have it, but it somehow protects you. That is how it works.
Okay.
But once you are being exposed to an infected person, there is some possibility that you can get TB.
You can get TB.
Yes.
Okay. You've mentioned the transmission. If you just hammer on it again, from person to person, how is it transmitted?
Okay, so like I said earlier on, somebody who has been infected with TB will have to cough or sneeze.
Okay.
So if you have TB and you are talking to me, even without nose mask, I'm okay. Because there is no way I can get TB. But once you cough or you sneeze, you bring out the Mycobacterium tuberculosis. You bring it into the atmosphere, especially if it's an enclosed area. The non-infected person also inhales it and it gets into the lungs of the person. The person also starts exhibiting the signs and symptoms.
Okay. What about if you have somebody like that, probably in the family, right? And so you eat together or you share the same washroom and stuff like that. Is there the possibility that you can transmit tuberculosis?
Okay. You have an infected person in your house. You can eat with the person on condition that the person is not going to cough while eating. On condition that the person is not going to sneeze while eating. But aside that, you can talk, you can laugh with the person. You're not going to get TB.
Okay. All right. Now let's look at the symptoms of tuberculosis and how we can actually recognize that.
Okay, so the first sign that we look out for, that is for the pulmonary tuberculosis. With the extrapulmonary, it's very difficult to detect.
Okay.
So if you are experiencing any pain in any part of your body, for instance, you have headache, joint pain, waist pain, you go to the hospital and then the doctors will have a way of diagnosing you of extrapulmonary tuberculosis. But with the pulmonary tuberculosis, the first sign that you have to look out for is cough. Any type of cough. Initially, we were looking at cough for more than 2 weeks. But right now, any type of cough, we are screening you for TB.
Okay.
And then we are looking at fever, as in increased body temperature. We are looking at that. And we are looking at loss of appetite, weight loss, night sweats. You can see that your AC is on, your fan is on, but you are still sweating. So you can come to the hospital. It could be TB.
Okay. You know, consistently when we meet on this segment, I learned something, you know, because these symptoms that you're mentioning, it could be symptoms of any other disease as well.
Yes.
And you know how when we are home, we have a headache, we take a painkiller. When we have a feverish condition, we think it's malaria and all that. It might not be that. It could be any other sickness. So it's important actually that we frequent the hospital when we have some symptoms and actually do tests to ensure that, you know, this is actually the sickness before we take medication, right?
Exactly. And then with TB test, it's free. The gene expert is free. So you can be doing the test frequently. Every 3 months, you can decide to go to any hospital, any government hospital to do the test. It's free.
Okay. Now tell me about the diagnosis. How is it diagnosed, and then the test that you just mentioned, how is it used to confirm to the diagnosis?
Okay, so when you come to the facility with any of the symptoms I mentioned earlier, cough, weight loss, night sweats, loss of appetite, when you come, we can do a gene expert test for you. So that one, we take your sputum, you cough up, you bring out sputum or flames, and then you go to the lab and then they test. If it's positive, we are going to know. And sometimes we can take chest x-ray to check how the lungs are, and then we will know if you have TB. And we have the last one known as the tuberculin skin test.
Okay.
That one, they inject something into the skin and then be able to detect if you have TB.
Okay. Okay. Now, after the diagnosis, let's look at the standard treatment for the disease, and if you can tell us how long that treatment will last.
Okay. TB treatment it's quite long, depending on the type of TB you have. That's how come we need nurses like myself, nurse, to step in so that we can assist you and encourage you to take your medication. So standard treatment for normal tuberculosis, that is the pulmonary tuberculosis, is just 6 months.
6 months.
Yes.
Just 6 months. I thought you were going to say just 6 days. 6 months. You're undergoing treatment for a disease. It's not just.
Okay. Yeah, so 6 months. So we have grouped it into two. We have the initial phase and the continuation phase. So initial phase, you take a combination of 4 drugs.
Okay.
Rifampicin, isoniazid, paracetamide, and ethambutol.
Don't worry. When we come, you prescribe it for
so
us.
depending on your weight, we take it according to your weight. So depending on your weight, we'll know the dosage to give you. And then we have the continuation phase. That is for 4 months.
Okay.
That one, you take rifampicin and isoniazid only, just these 2 drugs for 4 months. So it's very simple.
Okay, so just the drug medication, the medication, not you don't have to do any other thing. Lifestyle changes, any other thing that you need to do during this treatment period.
Okay, so we advise that you stop taking alcohol while you're on TB treatment.
Okay.
And then you stop smoking. So, and eat well, just eat well.
Okay. Eat well, stop drinking, stop smoking. Any possible complications that can arise from tuberculosis?
Yes. Just like any other disease condition, TB can cause you to die. You can die. TB can kill. And then it can cause a permanent lung damage. So if you don't go to the hospital for us to treat you in time, it can cause a permanent lung damage.
Okay. But is there a time? Okay. But if you diagnose it early and then you undergo treatment, you can make full recovery.
Yes, it's curable.
Okay.
So early detection saves.
All right. We'll be wrapping up shortly. We're looking at tuberculosis this afternoon. We have DOT nurse here, Armah Ehoneah Ndah, helping us go through tuberculosis. I want to know, and especially based on the question I asked earlier on about being in a family setting, one, how long one can be contagious, and how that person can protect the family from themselves.
Okay, so once you have TB, you have to help your family. So the first step is you have to invite any healthcare provider, a dot nurse, it could be TLSO. People have been trained to come into your homes. So you just invite us, and then we come to the house, and then we take samples of all your family members, those you live with, and then we test them. And they are negative. There is a drug that will protect them and prevent them from getting tuberculosis.
Okay.
Because you are still in their midst. They cannot isolate you. You don't need to be stigmatized.
Okay.
And then you have to do your part by taking your drugs religiously. Take it like the way you pray.
Maybe the person is not religious.
Okay. Most Ghanaians are religious.
Okay.
So take your drugs. If you're able to take the drugs daily for 2 weeks, you cannot spread the bacteria.
Okay.
So if you take it very well as prescribed for 2 weeks, you cannot spread it. And then your relatives to be on their TB preventive therapy.
Okay.
So they will take it weekly for 3 months.
Okay.
So they will also not get TB.
Hey. Anyway, you mentioned stigma. Is that an issue with TB?
Yeah, some people think that when I tell my relatives, initially I learned Ghana, when people had TB, they were isolating them, giving them food was even a problem.
Yeah, I remember when I was young, there was a man who lived close to us, and we were told he had TB. And during that period, before he died eventually. During that period, people were not going to him. Yeah, I mean, he was isolated. Yeah. I remember that.
Everyone was scared because they didn't know TB was curable. But now we know TB is curable. And then there is even a drug that will protect you from getting tuberculosis.
Okay.
So all you have to do is just feel free. Tell your relatives. I went to the hospital today and they said I have TB. And I encourage them to do the test as well. They'll do the test. If they are negative, there's a drug that will protect them from getting tuberculosis. And then you all be free. You get cured, and then nobody reinfects you again.
Okay. Are there any support groups or resources available for people with tuberculosis?
Okay, so I know of Global Fund, and because of their support, the TB drug is free. So when you get TB, you don't pay for the treatment. The entire 6 months, it's free. And then I know of National TB Program. They come to our facilities once in a while, and then they do free chest X-ray for all clients. So whether you have TB or not, you can come and do the free chest X-ray. So on 12 December, that is coming Thursday, they'll be coming to Weija-Gbawe Municipal Hospital, Akawe, to do a free chest TB chest X-ray for all of us. So please, if you are free, you can pass by and then come and do the X-ray.
All right. Quick one before we go. I think this listener missed something that we spoke about earlier, but Benjamin Adai sends a message, says, I want to find out if you are eating with an infected person with your hands in the same bowl like fufu with soup, would you get tuberculosis?
Please, you're not going to get tuberculosis because the bacteria only comes up when the person has coughed. And so once there is no cough or sneeze, there is no TB bacteria.
Okay, so you can eat from the same bowl.
Yes.
Please tell the person not to cough or sneeze whilst you are eating. You'll be safe. Somebody is asking about smoking. Says I should ask you for him. Smoking, they say no. They say yeah. They say it's not good. So please, if you can stop smoking. That's the message, right?
Let's stop smoking.
Let's stop smoking.
Let's stop.
Anyways, we have to wrap up. Anything else you want to leave listeners with this afternoon?
Okay, so let's do our best and then screen ourselves. So let's be doing the TB test often. You might not know when you get infected with TB. We are all at risk. We sit in taxis, trotro all the time.
People will be
People
coughing
are
and
coughing
sneezing at the marketplace.
Yes. So let's do our best and let's eat well. Because like I said, if we take 100,000 people, only 136. So if you are eating well, you have good immunity.
Yeah.
That's all.
You're not smoking, you're not drinking.
You're not drinking. You are good to go. So let's eat well. Let's take in fruits.
And you said on the 12th of December, what is happening?
We are having free chest X-ray at Weija-Gbawe Municipal Hospital, so you can pass by. All right.
Thank you very much, Nurse Armah Ehoneah Ndah. She's a dot nurse at Weija-Gbawe Municipal Hospital. Joined us this afternoon on our Hello Doc segment to talk about tuberculosis. Thanks very much for coming.
You're welcome.
All right, this is the Drive with the Area Gang here on PLUZZ 89.9 FM.